In today's session, it's all going to be about building strong nonprofit partnerships for a sustainable future. We know that a lot of you already have some background in the mental health space and may or may not know a lot of this information, but we hope that today can give you some talking points, some conversation starters, or new perspective regarding how to better connect with others and other organizations out there. We are honored today to be joined by Alice Jewell, the CEO of McKenna Foundation, located in New Braunfels. Today, Alice will be talking with us about funder-grantee relationship, how to build relationships with other organizations, and what a sustainable future looks like for nonprofits. So without further ado, I'll pass to Alice.
Thanks, Cody. I will go ahead and share my screen. Well, hello, everyone. It's really great to be with everybody. I have been tracking on the ECHO project for years, and it's really a honor to be talking as part of this conversation today. And especially alongside one of my best community colleagues, Jennifer Nieto. So today we're going to talk a little bit, like Cody said, about funder nonprofit relationships. We have a pretty unique situation here in New Braunfels and Comal County. I'm going to give you a little bit of background, but I'm going to start off with some maybe tools for the toolbox with regard to how to dream with intention for a different reality for your communities with regard to mental and behavioral health. Just to kind of give you some ideas. And then Jenny's going to talk to you a little bit about how we put some of those tools to action. So as a little bit of background about the McKenna Foundation, we've actually been in the New Braunfels and Comal County community for over 70 years. Our first 54 years was as our community's only acute care hospital. In 2008, the board at the time decided to sell the assets that the McKenna system had and convert that into what they call a health conversion foundation. So these are not uncommon across the country as healthcare is collapsing on each other and just moving to bigger institutions. But we did that here in New Braunfels and Comal County and established the McKenna Foundation in 2008. So we have been making grants since that time. Since then, we've given away just over $30 million, as well as operated a community center here near downtown New Braunfels, where we also have a children's museum and an event center, which is unique for a public charity, which is what we are. It's great in that it can really be an extension of our grant making to outreach to kids and families and children-oriented organizations through our Children's Museum, but then also as a convening space with our event center. So, if you know anything about New Braunfels, we are situated between Austin and San Antonio. It's like the worst kept secret ever that, we are really fast growing. I've lived in New Braunfels my whole life, and this has been the case for since I've been here and for at least 50 years that we are just experiencing an absolute growth trajectory. So when we came online, we knew that was the case. We knew that New Braunfels was growing, but we really didn't know what to do with regard to our grant making. So we decided let's be students of the community. Let's start asking questions. Let's start having conversations. Let's figure out what it really is that the community needed for us to invest our money in. And what we decided was that we are truly a community in crisis with regard to our social infrastructure. The community has grown, our population has grown, a lot of our public resources by way of our public safety and roads and things like that has grown alongside, with the city. But our social services infrastructure certainly has not. So we were really kind of behind the curve with regard to the growth. And I'm talking about really serious, fundamental issues, hunger, housing, mental and behavioral health, you name it, and we really needed to dig deep. So we realized very early on that digging deep with our nonprofit partners was something that the McKenna Foundation was going to need to do. Fortunately, we are philanthropists, right? Meaning for the love of people, we are in this work. We are a grant making public charity, which is great for us because it does make us a very nimble funder. There are things, of course, that we have to align with in order to stay, good with the IRS and reputable and credible. But we are really able to be nimble in what it is that we do. Which is good because you'll see that word there, building. Many times building something means starting from scratch or nearly at the beginning. And that is what we have had to do. Starting from scratch is the absolute hardest thing to do when it comes to development of infrastructure. It's not easy. We're going to go through a little bit of those things, but it's always good to have a work plan. In 2025, these are our three initiatives that we are funding around our community. You'll see it's probably too small for y'all to read, but we've got a housing work plan, a behavioral health work plan, an early childhood development work plan, all three of which have emerged as our community's biggest gaps. And so we're going to talk a little bit about how we came to some of these conclusions and how we've made progress on that coming up. So back in 2015, which seems like a lifetime ago now, when we were trying to decide how do we get our mental health work started, we convened a group of stakeholders. Like I said, we were students of the community. We uh, wanted to make sure that we were doing, more of the listening than the talking before we invested our money. So we convened our stakeholders, and we learned a lot of things at that time. We had nonprofits, we had law enforcement, we had schools, we had, a pretty diverse group, but the common thread and all of that was that they were all centered around mental health. Um, what they did not have in common necessarily was each other. So we had people that were just, doors away from each other who never worked together. So um, we knew that, that was definitely something that we needed to overcome. Introducing and convening like-minded folks is sometimes hard to do, but always fruitful. So we convened these groups and we started dreaming. That group came up with, I was hoping for, I don't know, like 5 or 6 goals, maybe that we could fund around that year and in the coming years. Well, that group came up with 23 goals. And so we were like, okay, well, let's just start eating this big old apple. So um, the two things that emerged from that was a mental health education and awareness campaign, but also it was creation of a mobile crisis outreach team, which we're going to give some detail about. But um, thinking about that process, we were dreaming about how to make the mental health services continuum more complete in New Braunfels and Comal County. A couple things we learned, there's a lot of noise, right? There's a lot of things going on in the community. There's even a lot of things going on within individual nonprofits and a lot of things that can distract you from the work. Like it's hard because these competing needs many times are all valid. Um, when you ask one person what's the biggest need in the community, it's just that one person's opinion about the biggest needs in the community. So lots of valid needs, but it does seem to make the field noisy and difficult to focus on any one thing. There's also this matter of trust. Who can you trust? Like I said, we had convened people in the same room who didn't know each other. Their um, businesses were related, but, and they maybe knew, by organizational name who was who. But as you all know, familiarity is one thing, trust is something else. And so we know that we need to establish these relationships of trust um, before crisis hits, before the vote is called, before we can sign on the dotted line. So Knowing who you can trust or trust enough to share goals and vision is really an important piece. We also realized that this was not going to, dreams were not going to become reality overnight. Planning takes time. I am a impatient person by nature, but patience in the development of programs, community programs is essential. Um, Part of why it takes so much time is because pivoting from um, obstacles, barriers, things that haven't worked, is going to be part of the process. So, the ability to pivot is so important. It does seem like it's a setback at times, both maybe emotionally and physically in time. But it just does all add to the process. I had a really great mentor one time give me probably some of the best advice I've received in my professional career, which was, Alice, never fall in love with a deal. And what that meant was never fall in love with a plan or a plan so strongly that you're not able to pivot in order to, reach your final goal. So we knew planning was going to take time. And the thing that I know is pressing on everybody's minds and budgets and heartstrings at this time is that we were living then, and we are especially living now in a changing funding environment. This is perhaps the most pressing thing to nonprofits right now, because without funding, we know dreams just can't come true. Without dollars, dreams are not happening. And typically when you're dreaming and you're starting from scratch, you need that startup money, and then you also need sustainability money, which you are all or many of you are either fundraisers or have a nonprofit business model of your own, and you know that where you get your startup money from and where you get your sustainability money from can many times be different pots with different rules. Just as a little aside, we did a economic impact report of the groups that are serving um, New Braunfels and Comal County, and our local groups just here reported about a 44% decrease from 23 to 24 in government and public agency funding, which is really significant. So we take that very seriously, and that was already a big number, and that big number is getting smaller. So we know that as nimble funders, we need to be thinking about how to do that. So, there's a lot of noise. What can you do? What steps do we need to take, knowing that we're living in kind of a cloudy, noisy environment? Don't be distracted by symptoms. We as funders, we look at the scenario where there are many issues that are symptoms of bigger needs, but really drilling down to look at what are the primary needs is really critical. What are some of the things that if we solved this issue, it would also solve these other three or four issues down the road. And many times, recognizing mental health struggles, properly diagnosing, properly connecting with either a clinical resource, maybe a peer resource, that's so important in the process. So defining the vision to make sure that it is at your core and it's not being diluted by, other everybody wants to solve everything at one time, but you just can't. So really drilling down into primary needs is critical in defining your vision. I mentioned a little bit about this, partnering with trusted allies and mentors. Don't be afraid to not use somebody as a partner. Focusing on people who can give resources either in leadership, in time, or in money. That's who you need by your side. And that's why funders like us, we consider ourselves a partner first, a funder second, and somebody who's willing to dream with you, and defining the vision and defining distilling out the plan is really critical. We want to turn these goals that we all share into actionable steps. So, getting started, just getting started seems like sometimes an insurmountable task. We've all heard of the analysis by paralysis, like what are we going to do? I don't know. What about this? Conditioning that, all these variables. Getting started with something is really, really critical. The roadmap does not need to be absolutely defined in order to get started. Um, Obviously, we want to begin with the end in mind, and we want our final destination to obviously be clear, but certainly knowing that the path might be windy is okay, but getting started on the path is really critical. And then adapting as funding and needs evolve. So that's where the partners come in, partners who can bring things to the table. They're not just going to suck resources out of you and your efforts, but people who can also contribute to the conversation, contribute to the advocacy, contribute to the funding, the time, bring new resources to the table. Certainly that they need your planning partners are also your sustainability partners. So we know we're going to have to adapt all of that kind of as the needs evolve. So I'm going to let Jenny get into the real story here. But in order to be intentional, some thoughts for you, cutting through the noise, like I said, to define the real need. What needs to be different? I had a board member one time who was not really that, he was not really that profound, but he asked me, Alice, what's going to be different in 10 years because of the McKenna Foundation? And we know that in order for something to be different in 10 years, typically in the social side of things, we've got to start making changes today. So in order for the landscape to look different, we have to define how we want it to look different and kind of backtrack from that. And what I've found is it's probably more simple than you think. It's probably distilling it down to its most basic components that is really going to give you the best return on investment. Finding a partner that will plan alongside you. Like I said, we are so fortunate to be here in New Braunfels and Comal County, and our groups know, that our staff here is willing to, we will cry with you, we will hug it out, we will plan, we will research, we will, do whatever it is that can help influence the design of things because, the design is just so critical to the process. And I mentioned this a little bit, but as a recap, just recognizing funding is changing and will continue to change. We found some value, and Jenny will speak to this, of coming along public institutions who are already doing the work. They are already in the work of, law enforcement and community development and things like that. Their funding may get cut too, but they're already charged with some of the similar things that we're charged with doing. So bringing them alongside as a partner is really great. Earning what you can, earn money is gold, and continuously growing our operational partners. So I can't wait for Jenny to tell you about how we were able to put some of these nuggets to life. So it's my pleasure to turn over the talking to my colleague and friend Jennifer Nieto, who is the Director of Clinical Operations for Hill Country MHDD.
Hi, thanks, Alice, and hello to everybody, and thanks for your comments. I've just been reading through those. I'm really happy to be here to talk to you about our relationship and how that's grown resources in Comal County. But just to kind of give you a baseline of where we were 10 years ago, I work again for Hill Country MHDD Centers. For those that don't know, we're designated as a local mental health authority in 19 counties across Texas, one of those being Comal County. Because of that designation, we do receive like general grant funding through the state. That funding allows us to operate basic mental health services, right? So think of your, traditional CBT, psychiatry, nursing, case management, kind of that typical package, right? Peer services and skills training, psychosocial rehab. Crisis intervention, though we know it to be a critical part of the mental health system, is typically not funded or even reimbursed very well through the state, as far as my experience has been, and I've been in this field for now almost 20 years. So crisis services tend to be like, hey, do all of these other things with your grant funding, but also if somebody is feeling suicidal, homicidal, or aggressing in your community, we've got to prioritize them and make them, get attention to them, and disposition a recommendation quickly for them. That's very difficult to do when you're running an outpatient clinic. And as Alice mentioned, we are a fast growing community in Comal. So you already have caseloads of, hundreds of people, to be honest. Very difficult to respond to a crisis in your community when you already have appointments scheduled back to back. So very early on, when we were meeting as mental health partners in Comal County, there was this need of creating a focused team of mental health professionals to address individuals who were in a mental health crisis in that moment where they were. Up until that point, we were just, referring people to the emergency room. When we had a moment in our day, we would get over to the emergency room to do that assessment. This was costing our community resources as well as the individuals in crisis a lot of money, as you can imagine. And so we knew there was a way to do it better. We just didn't know how to make it happen. So when we partnered up in this group of mental health professionals, and I will just share with you, and this is a funny part of the story, the grant was submitted, the grant application was submitted for this mobile crisis outreach team, and a few months prior to me becoming the director of that clinic. And so not only when I first met Alice was it to say, hey, thank you for funding this crisis team, but by the way, I am brand new and have never done this before. So talk about trusting your partners. We didn't even know each other. But I knew that there was this stakeholder group. I knew that I was told I needed to make it to these monthly meetings with these other mental health partners in our community and with the McKenna representation at the table. And really, y'all know probably in this room when we're operating, a clinic, a nonprofit, our days are stacked, right? Every minute is accounted for. And now I'm thinking, well, I'm learning my position as a new director, and I've got to figure out how to build this relationship and make these meetings. I don't know what's going on, but they're funding our crisis team, so I better get my butt in the chair, right? I just want to speak to the importance of that. There's never going to be enough time. There was never enough time to dedicate all of those to all of those community meetings. What I did on the back end was really cross-train a lot of my clinic team members so that they could hold the clinic down while I could be out in the community meeting with our partners. And I go into this on this slide because the importance of that is that that's where I could also come alongside Alice and McKenna in becoming students of our community and really hearing what they understood the gaps to be. So I'm really well versed in gaps in funding, right? But I'm so in the middle of the day-to-day providing services that I'm not necessarily hearing where the gaps in care are at a community level. So going to these meetings allowed me to hear from other partners what their experiences were. We even had some folks from the community that were receiving services talk to us about where some gaps were. It also helped me to build relationships with, sometimes we would have judges and elected officials in some of our meetings, decision makers from our community, obviously other nonprofit partners. So as I was coming through my, early on in my career, I was able to make those connections and then also hear for those gaps. So Alice, would you mind switching over that slide? Thank you. So one of the meetings that we have was this one, was the mental advocacy partners. This is where, again, most of the nonprofits who address the social needs specific to mental health would come together monthly. Identifying gaps, we were talking about crisis services. I knew what crisis services looked like from my angle, but I didn't know what, the private therapist was experiencing when she's talking to somebody who expresses suicidal ideation. What support can we provide that person? We were hearing from the police department and sheriff's office. What were they experiencing out in the field? And so here is where we made our application again, got that grant, and we were awarded our initial funds to begin MCOT November 2015. So what that created was the ability to hire 3 dedicated qualified mental health professionals to provide immediate response wherever a person was in Comal County when they were feeling suicidal, homicidal, or a general regression in their mental health to the point that they became a danger to themselves or to others. And we started really very organically just hearing the calls, getting activated, and this 3-person team could go out and provide intervention services, make a recommendation, help coordinate placement if hospitalization was needed, or help to create some sort of plan for safety in the moment. So a little bit about our MCOT, where obviously we operate 24 hours a day. We have the dedicated response team, and this is how we really started. It's grown quite a bit from here. But one of the things that we were required to do very early on, as you can imagine, being a grant, was that we had to collect data. And y'all, I wish I could see your faces when I tell you this. We started with tally marks on paper. Hold, pause for the gasp. We started with tally marks on paper. We did not have a very sophisticated electronic health record. Thank you, Lauren, right? Health record to be used. We didn't know what reports to pull out. We just knew that the McKenna Foundation had granted us some funds, and we needed to make sure that we could turn in some numbers over to them. We made sure that the data we collected was never just to address the needs of today, but to project the needs of, the next year, the next 5 years, the next 10 years. And so we looked at needs, we looked at barriers, we looked at trends, we gather data now. I mean, y'all, I just had a meeting yesterday over at McKenna because we are taking all the data we have gathered since 2015 and we just keep adding to it because we're learning more and more about our community. In addition to that data, the McKenna Foundation also said, well, hey, listen, also in part of funding MCOT, we're going to require you to work with some of the other folks that we're funding, right? Other organizations. So that was like, okay, yeah, okay, I've never met them, but that's cool. We can do that too. And so this really forced, but y'all, these are some of like my best friends and colleagues now, but it really forced us to have a relationship with the other nonprofits. This helped make, and I say this all the time, it really helped to solidify a safety net across our county, right? Because if several nonprofit partners are also being funded through the McKenna Foundation, and one of their requirements is that we're all working together, it just kind of makes for this beautiful safety approach throughout, because none of us, definitely not Hill Country, is equipped to or wants to do all the heavy lifting, right? None of us can. In addition to the meeting attendance and the data analysis, we do quarterly reporting. What's really cool about that quarterly reporting is it never felt like a punitive moment with the foundation. I knew that when I reported data out to the foundation, which we did quarterly, I knew that if some of my numbers were low, I was not going to be threatened with pulled funding. I was not going to be, criticized or need to like have a come to Jesus moment. It was always met with curiosity. Hey, why isn't that working? Or what can we do differently to get this where it needs to be? And so to that, I was sharing with Alice, it never felt like the McKenna Foundation only funded MCOT. It really felt like they were funding suicide prevention in our community. And that's powerful because not only do I need to gain Alice's trust, but I had to be able to trust her and the foundation. This is my passion, right? This is our work. This is our passion. And so we had to be able to trust that we were both in it, for the things that were really important for our community, which through MCOT really is a focus on suicide prevention. So through the data and the outcomes, as you can imagine, over 10 years, we have revealed multiple gaps. What initially looked like one gap in crisis intervention, it was like, okay, we kind of got on top of that, but now there's all these other things that are starting to really reveal themselves. Specifically with jail-based services, a lack of resources in the more rural parts of our county, lack of services for our unhoused neighbors in the community, and we have a lack of hospital resources. And what I mean specifically by that is that we don't have an inpatient psychiatric hospital in Comal County. And so anytime we're recommending hospitalization, these individuals are having to cross county lines, which legally becomes a little muddy, but they're also leaving their loved ones and their natural supports. And there were also some challenges with law enforcement, right? While we have the same goals typically with our law enforcement partners, our approaches tend to be different. And so it really necessitated us having a really strong relationship with them and an understanding with them as well. So the data also revealed risk in other areas. And when we would look at stressors and contributors to crisis, we would learn about the just really shockingly high rate of kids and adolescents in our community that were at risk for suicide. We learned about substance use across our activations, counting or being part of at least 1/3 of all of our calls. And of course, the ongoing stigma associated with not only mental health and behavioral health, but also with talking openly about suicide. I love that photo. And so from all of this, and y'all really, it took all 10 years to get here. But these are some other projects and success stories that we've had through the relationships, the data, and just that commitment to suicide prevention in our community. Now in Comal County, we have mental health deputies, we have mental health officers with the police department. We have our own mental health specialty court. And for some of you that may be in the meeting, you're like, wait, we've had that for like 30 years. Y'all, in Comal County, we did not have these things 10 years ago. We probably couldn't have even dreamt of it 10 years ago. One of the really cool programs is that we were able to open a mental health clinic in that more rural area of our county. So if you're familiar with the Canyon Lake area, and Spring Branch and Bulverde, we have no public transportation, right? We had one outpatient mental health clinic in New Braunfels that was open from 8 to 5. So if you needed mental health treatment and you lived out in one of those areas, you know, that's about 45 minutes, an hour away. That was going to be a major barrier and challenge. And so being able to build or have that clinic out in Canyon Lake and then a remote clinic in Spring Branch really helped to bring preventative services to those areas. And that was just from looking at data that showed us, hey, Canyon Lake has the same number of activations as New Braunfels. Why are we having to hospitalize so many more people from Canyon Lake than we are from New Braunfels? Well, it was because we had many more resources in New Braunfels to assist in that preventative care. We now have a dedicated mental health team with a program called Next Step, which helps to serve through comprehensive care our unhoused neighbors. And so that dedicated team has office space at both of our unhoused shelters, which is very cool, to bring mental health care to them. All right. Oh, yes. We always need, look, so let me save y'all some time. This is a real quick rundown of things I wish I would have known 10 years ago. The first one, like I said, you're never going to have enough time. You want to use your time well, but you also want to accept every invitation you are extended. And I, in front of Alice, will say, I said yes to things only because it was like, well, Alice asked me to, and y'all, you know, like they're helping us fund MCOT, so that's what we have to do. And just really quickly, I will share with you, one of our partners said, hey, Jenny, there's like a leadership New Braunfels class. I need you to go speak about, you know, what y'all do. It's for volunteers, and maybe you could get a volunteer out of it. Well, in a mental health clinic, we really can't use a whole lot of volunteers. There's too much private health information going around in a mental health clinic. But I was like, well, I don't really have a need for volunteers, but I guess I'll go speak at it. Every time I have spoken at that, which now I do it every year, we are able to get additional partners because these are folks that are bringing new programs into New Braunfels, hearing what we're doing, and then wanting to work alongside us. And so that's been incredible. And I only offer that as like, no invitation is too small. Take advantage of every audience you're in front of. listening to the community. There were a lot of very difficult, humbling conversations we had very early on. Being a community mental health provider, y'all know I have to have very thick skin because I walk into rooms where, we don't help people. We have a long waiting list. The stigma goes on and on and on and on, and some of it for good reason. We've earned some of that. But even in those hard conversations, staying curious, building trust, avoid being defensive, and staying in a place of problem solving usually helps in that relationship build. Represent the ones you serve, not your agency yourself. That's a big one for me. I walk into rooms knowing that, of the hundreds of people that we serve there in Comal County, I think we are now up to close to 3,000 people served in Comal County. I never walked into a room only representing Hill Country or myself as Jenny, but always the idea that let me be a mouthpiece for the people who are not being invited to those same tables. What did they want to see in crisis response? Word of mouth goes further than any presentation. I could go to as many meetings as I wanted to or had time to, but if the mobile crisis outreach team was not doing professional, productive work in our community, we were going to fall flat on our face. And so keeping them very well trained, keeping them very efficient, and making sure that they respected our partners really helped us go a long way. And keeping our other partners close. Yes. I think us in the mental health field, we know none of us are, again, trying to do all the heavy lift. So we were never in competition with any of our partners. We were always in full partnership mode, but none of us duplicating services. So if I could pull in one of our partners to provide counseling and I'm providing that psychiatric piece, we were working together. That helps to make a larger safety net for that person. And this is something that I heard Alice mention a little bit about, but action creates readiness, not the other way around. Y'all, we had no idea what MCOT would look like. We had no idea operationally what that was going to require. And I think if we would have spent too much time trying to figure out all the details, we would have never started. Funding, obviously, and staff members are two parts that are definitely needed. But once you have those and a dream and a great intention, evidence behind you, it's time to move forward. And even now we have projects on the docket that I'm like, man, I don't know how we're going to swing that, but we will. Yeah. Oh, well, speaking of some of the things that we have ahead, we have these awesome, y'all, they're so incredible, mobile clinic vans. Again, we're just trying to address that transportation gap in our communities. These are vans that are fully equipped. When you open the back of it, it's like a counseling office. It's amazing. And we're bringing those out to the most rural parts of our communities that we serve in order to bring psychiatric medication, but also counseling services to people who don't have the ability to come to our clinics. Dedicated mental health services for our county jail. So we do have a jail-based competency restoration program. I should have added that as one of our wins because that came after MCOT. But in addition to that, we are now going to have a team of therapists in the county jail just working with folks while they are incarcerated, but also to prepare them for release. This is huge. We are expanding our MCOT. So we continue to apply for MCOT funding to the McKenna Foundation all these years later. But in listening to our community, we do try to adapt and expand MCOT to meet the needs. So now what we are doing is embedding a mental health professional at our city's dispatch so that even at Intercept 0, people are talking with a mental health professional. We are very excited about this, and hopefully we can come back and talk with some of you as it gets going. We are also having built in Comal County a 17-bed psychiatric facility. This is very exciting because I said earlier we didn't have this in place. We still don't. It's being built. Y'all know how that goes. But the funding is there. We are ready to operate. We're ready to go with it, and that's very exciting. That picture down bottom right is our groundbreaking that we had. We are going to continue to develop that mental health team with Next Step as we listen to our partners, as we see the demands grow within our unhoused population. We we'll continue to develop our team to meet their needs. And then medication-assisted treatment for individuals with certain substance use disorders. So again, these are all, services and supports that, going back to our general grant block funding from the state, these are not services that are covered through that funding. These are all born from relationships and the data. No, thank you, Alice. That's fine. Okay, well, there's my information. So if you ever have questions or want to speak in more detail about any of these projects, please shoot me an email or give me a call.